Thank you so much for all coming out. Yes, it's showtime, and we are starting right on time, so I'm excited about that. Anyways, I know there's a lot of things you guys could be doing tonight, and I'm really excited that you guys are taking your health into your own hands and coming here to learn something new. And tonight we have Dr. Tom coming in, and he's going to be talking about lab works, he's going to be talking about some vitamins, some of those types of things too. So I think this is going to be really important for a lot of you guys that have asked me questions about what should I be taking, what's this mean, and all of those other questions that deal with our inner body that obviously you guys have been thinking about. So without further ado, I want to talk and have Dr. Tom Culleton come up front. He's a Canadian who has, you currently have a practice in New York and Austin. All right,
Thank you, Doc. Okay, nice to be here. I'm from Windsor, Ontario, so the border city, south of Detroit, Michigan. You know that song, Born and Raised in South Detroit? That's my hometown, right, Windsor, Ontario. And I went to school in St. Louis and then practiced for 12 years in New York, and then the last 16 in Austin, Texas. So I'm back home in Canada trying to figure out what I'm going to be doing. I just got my Michigan license, so I might open up there and bounce around a few other places, maybe Wisconsin too. So tonight we're going to have about a 40-minute conversation about the power of doing blood work and the importance of identifying and correcting these metabolic subluxations. You guys heard that term, subluxation? Hands up if you heard the term subluxation in this practice. Good job, Doc, of course. Awesome. So that's my business partner, Steve Giannopoulos. You don't have to be bald to be a male chiropractor, but most people think. And we've been buddies for the longest time. And so we met when we did the neurology program. So I'm a chiropractic neurologist. So there was a point in time, I've taught a weekend seminar somewhere in the world every month since 1996. And so there was a time when I just did all neurology, movement disorders, tremors, Parkinson's, concussions, some of the Blackhawks, a lot of the Dallas Stars and Red Wings, a lot of their NFL players. And so I did a lot of neurology, and there was a period of time where myself and two other people were the only people in the world teaching it. So I have a really good knack of neurology. But what I found was that when we were adjusting our patients and doing the very best we could from a neurological perspective, eye exercises, vestibular exercises, balance exercises, we kept doing all these things to really advance the patient forward, but sometimes they were stuck. Or you probably felt it, sometimes you get adjusted here, maybe your adjustment doesn't just hold as long as it typically would, or what you might expect it to do. So there's some other interferences, and that's what we're going to talk about tonight. So Steve and I, we decided to, because of our knowledge base in neurology, we started getting involved in this world called functional medicine. You might have heard of this stuff. And what we started to realize is that, you know what? The best adjustment I gave ever on that day, if the patient had anemia, meaning low oxygen, or if they had low thyroid function, or low vitamin D, or they were diabetic, they were still diabetic after I adjusted them. And then we would sit there and say, but you really got to get off your diabetic meds. Like, that'd be a really good thing. And like, but we don't know what to do, doc. I'm like, well, just change what you're doing. And that wasn't really the best approach. So we started realizing that we really had to dive into this. So my practice was neurology. It was functional medicine for a very long period of time. And from birth to grave, that everybody got adjusted. And we looked at every single patient got blood work in our office. Which sounds weird, eh? In the chiropractic office? Like, most of you probably wouldn't think you'd go to the chiropractor to get blood work, correct? Like, that's weird, right? So I really want to dispel that myth tonight and really help you identify why you need to do it in the chiropractic model. Okay, this is a chart, and charts are always confusing, and all this chart says is, as a nation, what do you think? Is the United States of America getting sicker or sicker on a regular basis, on a daily basis? We're getting what? We're getting sicker. How many of you here think that all we need are more doctors, more nurses? You know what we need? Oh, if right here on the corner in Willowbrook, if we just had another 24-hour emergency office, right? Or if they built a brand new hospital, would that make the community healthier?
No.
They're excellent at emergent care. Excellent at emergent care. But when it comes to healthcare, it's not their gig. So more doctors, more nurses, more hospitals, more drugs,
Nope.
and more CAT scans? Right? That's really not the solution to the problem, right? That's really not the solution to the problem. So we have to start looking at things, and I want to talk to you about two different paradigms. The paradigms of the current healthcare model and the paradigm that Dr. Krieg and her crew here really try to promote to you. This wilting plant, if it was in the medical community, it would be diagnosed with something like brown leaf syndrome, wilting plant syndrome, right? That way it would get a diagnosis, and as a consequence of that, there would be some sort of medical intervention. So I want you guys, even though you don't have a PhD in taking care of plants, what does that plant need to get better? What does it need?
Water.
Everybody on the planet always says water. What else does it need?
Sunlight.
Water and what? Sunshine, right? Hard to come by around these parts, right? Austin, Texas, the sun's a little brighter. We need water, we need sunshine, we need food, nutrients in the soil, and what else? One last thing, what do we need? You gotta talk to that plant. You gotta water it, turn it. You look beautiful today. Right? The plant, here's you. So if you do that to the plant, if you give the plant what the plant needs, it's going to what? Grow. It's gonna thrive. It will thrive. That's the model that we're after. That's our healthcare paradigm. Not this. We're not interested in taking that wilting plant, the brown leaf syndrome plant, and going to Home Depot and buying spray paint and painting the leaves green. Because now what? The plant looks healthy, right? Does everybody, like the plant looks better, doesn't have green or brown leaves. And so I know with that analogy, for a lot of you, what I want you to say is this. If it was the brown leaf syndrome, if the plant was sick, welcome guys. If it was brown leaf syndrome, in the medical community, they're gonna sit there and say, why don't we cut off all the brown leaves? And don't worry about giving the plant what the plant needs. Let's just make it look better. You know that's true because if someone has their cholesterol's off, what's done about it? They get a what? We're gonna start, there you go, here. We'll make it look better. We'll paint the leaf green. What else you got? What else you have? Oh, you have hypertension? No problem. Here, we got one here. Got that for that too. What else you need? Depressed? Here, good. What else? And in other words, they're not really getting to the root cause of the problem. Welcome in, folks. Come on in. Hi. Right? We're not really getting to the root cause of the problem. It's really getting to the point of painting the leaves green. So that's the typical healthcare paradigm. No matter what you have, you got a headache, we got something for that. We're going to cover it up. In this model, in this office, in the chiropractic, in the wellness paradigm, it's why don't we identify what we're missing and give you what you need. Okay? I hope that makes sense for everybody. So here at Abundant Health Chiropractic, right? Whether you're seeking pain relief or striving for overall wellness, we are here to guide you on your journey to a healthier, more vibrant, more abundant life. Okay, how many of you presented here with some sort of complaint? Neck pain, a back pain, a headache, a gut ache, earaches, or something. How many of you had some kind of... So everybody was a wilting plant, right? How many of you decided to paint your leaves green first before you came in here? Right? How many of you tried to do something for yourself first? Meaning if you had a headache, you probably took something for a while, or some sort of Tylenol for your back or your neck or whatever was bothering you, right? Because that's what humans do. We have some sort of a symptom. We'll let you come on in. Hello. So we have some sort of a symptom, right? And with the symptom, we all start to paint the leaves green. But at some point you decide, what I'm doing is not working, so you decide to come in here. So you came in here and you got to see Dr. Krieg, Dr. Karen. Okay, how many of you had an x-ray when you came in the office here? Quite a few of you, right? Now when you got your x-ray taken, some of you were told that you had a vertebral, what's that word? Vertebral subluxations, right? Vertebral subluxations. Now you don't have to have your doctorate to understand that that spine's not the best looking spine, right? How many of you want that spine right there, that nice crooked one? Anyone? Yeah. Nobody, right? So we know that individuals like yourselves come in as the wilting plant. You've painted the leaves green for a while, but now it's time to get to the root cause and start correcting the problem, correct? We need to do that. So you had an x-ray, vertebral subluxation was identified, and then you started getting adjusted, right? And what's the hope of the adjustment? Not just to cover it up, but to try to help correct the problem. So with detecting and correcting vertebral subluxations, that's what Dr. Karen does, expertise here. And what I'd like to go ahead and focus on is now is a little bit more about this x-ray, a little bit more about the bones, about the vertebrae. And this is where it's going to make sense as to why you should have blood work done in the chiropractic office. Because some of you are going to say tonight, well, can't I just have my medical doctor order these tests? And my answer is always, of course you can. But why haven't they done it yet? I know you've been seeing that individual for a while. Why haven't they done the tests that we're going to be talking about tonight? So let's talk about this. Here's that spine with all these vertebral subluxations. And we can see that Dr. Karen's going to be adjusting those. But what I want to know is what nutrients do the bones themselves need? What do they need to get better? Let's hear it. Calcium. And?
Magnesium.
Magnesium, yes. And vitamin D. All right. Not bad, Doc. Hey, you got a smart crew here. Love it. So your vitamin D, your calcium, magnesium. Ready? How many of you take vitamin D right now? Everybody's going to raise their hand. Look around. Everybody raise their hand. Great. How do you know how much to take? Well, sometimes the doctor tells you, but most people, what do? They look at what? Probably the bottle. What's the bottle say? We're going to give you the minimal dose, right? Or you get it at GNC, and you have the high school student who's working there part-time, and you walk in and say, I think I need some vitamin D. Do you have any vitamin D? And he or she says, sure. We have some right here, right on the front of the counter, because it's getting ready to expire, right? The boss said we got to push this, so off the shelf it goes. How much should I take? Read the label. Well, vitamin D is critical for bone health. And you know, a couple years ago, there was this thing, what was it called? COVID? Anybody heard of it? And COVID, and it really brought out the light that the immune system can be compromised, and people were really nervous. So what did everybody start taking? People started taking things like elderberry, and they started taking things like zinc, and they started taking a whole bunch of vitamin D for the immune system. So tonight I want you to walk away with a few things. That vitamin D, you know, is critically important for bone health. Critically important for bone health. Critically important for immune health. You're taking vitamin D. How many of you in this room right now know what your vitamin D level actually is? Not many. A couple of people had their blood work just done, right? That I already interpreted. And so my point to you is I love that you're taking your hard-earned money and you're purchasing somewhere vitamin D, and you're taking some in an effort to make yourself better. Correct? That's what we're doing. But let's make it the best effort possible. Meaning, if you're taking it, we might as well take the proper dose. We might as well measure how much you're taking in, how much you're absorbing. Right? We should look at it now and then look at it again in a period of time. Same thing with calcium is married to vitamin D. Calcium is married to vitamin D. You want to stop osteoporosis and all these things? You don't need calcium. It's the vitamin D that's responsible for maintaining calcium. Everybody good with that? A lot of people don't even ever need calcium. You don't even need to take it. It's the vitamin D level that's critically important. So we'll go over that in just a minute here. All right, good job, folks. Now, when you've seen this spine, of course, Abundant Health Chiropractic, now Dr. Karen orders all this testing for you. How many of you have seen a diagram like this have been exposed to the fact that these vertebral subluxations interfere with your what? Your nerves, right? Your neurological integrity. It interferes with it. So my important question to you is this: when Dr. Karen gives you that best adjustment, oof, she walks away, she's high-fiving, she's, wow, love it, right? But she also knows in the back of her mind, this is why she's doing this testing now, is that the nerves need to be free of physical interference. That's the adjustments are going to help there, but it needs to be free of metabolic interference. What vitamins are necessary for your nerves to function? I'll give you a hint. It starts with a B. Vitamin B. Vitamin B. 12 is 1. Good? Not 6. Add 3. 9. Yeah.
Where's the B9?
B9? Yeah. Folate. B9, folate, B12. These are what your nerves need. Who's taking B12? Who's taking B complex? Who's taking B12? A couple of people. Again, my question to you is, how much are you taking? How long have you been taking it? And do you have any idea what your B12 level is? Do you think that would be important?
Yeah.
It makes sense, right? If you're taking vitamin D, you should know what your vitamin D level is. Maybe you're taking too much. That's not good. Too much vitamin D is also a very bad thing. It steals calcium from your bone and gives you osteoporosis. So we need to be paying attention. We need to know the numbers. All right. So B9 and B12 are going to be important for your what? Your nerves. Awesome. Good job, folks. Again, Abundant Health Chiropractic can test these for you. Could you have these done at your medical doctor's office? Yes. It's not done. It's not typically done. Oh, have you seen a diagram like this somewhere? Right, Dr. Karen, you probably maybe shown this around once in a while. I love this because what it says is, here's your vertebrae. Remind me, the bones need what to be healthy? What do they need, the bones? They need vitamin D and calcium and magnesium. And the nerves need B9 and B12. Nice, good job. Now your nerves are going to go to which organs? Which vital organs? All of them or all of them? All of them. Right, it goes to all of them. So, it's interesting, right? Because some people come in here, maybe with a mid-back pain, and after they start getting adjusted and get their subluxations corrected, like their heartburn goes away for some people. A totally unexpected result, right? Well, our muscles and vital organs need nerve flow, and they need fuel. What does that mean? You need red blood cells. What do red blood cells carry? Oxygen or oxygen? Oxygen. Nice. Your red blood cells carry oxygen. Now, men don't really hear about anemia too often, but a lot of women know what anemia is, right? You know, you have a low blood cell or you have an iron deficiency, right? And so we have to be aware and understand that not having enough oxygen is a big problem. Right? It's the main fuel for every cell in your body to work. Your red blood cells provide oxygen, and how many of you know what your glucose level is? Your blood sugar level. Do you think we have a blood sugar problem in this country?
Yes.
We're the most pre-diabetic, diabetic, insulin-resistant population on the planet. So we need glucose, we need oxygen. So the organs can function to the best of their ability, right? The wilting plant needs water, it needs sunshine, it needs all those things you talked about. So the wilting human needs oxygen and glucose, and we've got to make sure that those levels are pristine. Make sense for everyone? Ooh, how many of you presented with some sort of inflammation? And for some people, they don't even know it's the inflammation, it's their guts on fire. You know, like, some people eat and they bloat, you know? When should you ever bloat? Never. You should never, ever bloat. Women around their cycle will give you a couple days grace, but outside of that, you should never bloat. You should never eat a meal and be like, I'll bloat it. Your body's screaming to you inflammation. So whether it's joint inflammation, head inflammation, wait a minute. Maybe it's just me and my experience being Canadian, but anybody here ever been hungover? No, that's a big no. So, okay, you know, the night before when you're having drinks and the music's loud and the lights are going and everybody's having a great time and you can do whatever you want, man, the next day,
I'm sorry, what you heard?
when you're hungover the next day, the same music's too loud. The same lights, too bright. Shut up, kids! Or the neighbors or the construction. Like when you're hungover, you're miserable, right? Like you're not fun to be around. And you know, a lot of people come in this practice every day hungover and they've never touched a drink. They're so inflamed. You know what it's like. If you're hurting and you're just not feeling good month after month, your brain is inflamed. You are not the same person. I say it all the time. I see patients, and I know you two have seen the patients come in. Like, I can't wait to meet you once you're feeling better. Because we don't get to meet you. We meet you who's suffering, and we got to chisel away at you and finally sculpt up. There you are. It's great to meet you. Right? How many people do you think with all their inflammation that impacts your mood, it impacts your behavior? How many people are painting the leaves green there? How many people are on antidepressants and all kinds of other things to try to dampen their inflammation? So we look at all this and say we really have to try to identify all these aspects for you. Again, Abundant Health Chiropractic can guess or test. What should they do? All right, so let's look at this blood panel again. We need vitamin D and calcium and magnesium for the health of your bones, but that vitamin D is also very important for your immune system. Let's do it again. Vitamin D is important for your bones, and it's important for your immune system function. Everybody's good with that. Vitamin B9 and 12 for your nerves. Which nerves? All of them. All of them. Your red blood cells carry oxygen. Glucose is glucose, fuel, right? That's fuel for your brain and everywhere else. We didn't talk about cholesterol, but cholesterol sure has a bad connotation, doesn't it? Cholesterol, you need it to make testosterone, estrogen, progesterone, cortisol, pregnenolone. In other words, you need cholesterol to make all your steroid hormones. Some people are on statins, and their cholesterol gets too low. Now they can't make testosterone, estrogen, progesterone. So cholesterol is a big, thyroid is a big deal. I teach a 3-day course called Mastering the Thyroid and Mastering Brain Neurochemistry and all kinds of the 3-day courses for docs. But thyroid is very challenging. And if you don't have enough thyroid hormone, you're wiped out, you're exhausted, you gain weight, your hair thins, you get dry skin, constipation. You know who's the perfect example of low thyroid? There was a lady in town here. What was her name? Oprah? Remember that lady? Yeah. Oprah has hypothyroidism, classic case. And she would always battle the ups and the downs and the highs and lows. And interesting, right? Even though she ran the Chicago Marathon, she was still way heavier than what she wanted to be, despite all the exercise. So sometimes we really focus on, we have to look at thyroid and liver and inflammation. So we look at all these on your very comprehensive blood panel that Dr. Karen does for you. I'm her interpretation team. I have an expertise in blood chemistry. I teach to about 5,000 doctors a year, right? Medical doctors, oncologists, gynecologists, endocrinologists, chiropractors, nurses, acupuncturists. They all come to listen to me to say, how do we make this realistic in our practice? So we look at all this and try to think, we need to measure all of these on you. So if your spine's out of alignment, it's called the vertebral subluxation. And when your blood chemistry is out of alignment, we call it a metabolic. And it needs to be adjusted. So what we're going to do is we take your blood work and we color code it. Red means it's outside the lab range, either too high or too low. You're in the sick person zone. Yellow means you're not there yet, but you are creeping in that direction. So let's look at this for example. This individual, the only thing that would matter to a primary care doctor is that the hemoglobin A1C, so blood sugar, this person's pre-diabetic. Everything else would not have any relevance. So I want to zoom in here on vitamin D. Ready? Here's vitamin D. Here's the lab range, 30 to 100. Look, if I had $30 in one pocket and $100 in the other pocket, and I could say you got to have any value in between, how much do you want?
100.
You want the 100. Pretty close to it, eh? Maybe $99, leave a buck for somebody else, but, right? Okay, same thing with vitamin D. The lab range is 30 to 100. And this patient's vitamin D is?
30.
Now, I color-coded it yellow. It's completely normal. It's complete. So what's going to be done, even if your doctor orders your vitamin D for you, what's going to be done about it? Is it going to be addressed?
No.
It's not going to be addressed. Like, how's my vitamin D, doc? And they're going to say you it's what? It's normal. And you say, well, doc, should I take some vitamin D? And what are they going to say?
No, you don't need
You can if you want, but if you want to waste your money, or it's probably not going to do anything for you. What's that? Yeah, so lab ranges come from the labs. So there's actually,
No, I mean, who decides what's normal? It's the average.
so it's the average of all the people. So if you take 10,000 people that go to the lab here,
And they're all sick.
and they're all sick. My point exactly. That's why we don't look at 30. Mr. Cross, what do we want? We talked earlier. What do we want our vitamin D to be? Remember the number? About 70. 70. If you have autoimmunity, we're going to be more aggressive. 100.
Wow. Well, really?
That 30.9 is completely ignored. And not only does that impact the bone, but it also impacts the what? The immune system. It impacts the immune system. Should this patient be taking vitamin D?
Yes.
If this was you, would you be taking vitamin D?
Yes.
Great. How much?
I don't know. That's the question.
Exactly.
10,000.
Right? I don't know. I'll take a couple drops and take. I don't know. And then when do you test to see if it's doing anything beneficial for you? Right? Because some people are taking 1,000 units a day, and it gets into, then they add like another 4,000. Now they're taking 5,000 a day, and when they're taking 5,000 a day, they're still stuck at 44. So they need more. They're doing a great effort, but they need more. So we're going to use the data, right? We're going to use the data. Does that make sense for everybody?
Yeah.
So when we do blood work, the red is going to be what most practitioners are going to look at, right? They look at your blood work and go, everything's fine. Or they call, they just call the nurse's office, right? Calls, hey, we got your blood results back and everything looks what?
Great.
You're fine. But why do I feel like this, doc? I don't know. You sure you're not depressed?
Yeah.
And I think they do it out of the kindness of their heart. I really do. I don't think they're, I think they're trying with what they have to work with, you know? This lady's completely wiped out, right? She's like, Doc, I'm too heavy. I'm exhausted all the time. I don't know, is it my thyroid? Can you please just order blood work on me? I think it's my thyroid. I think it's this. Can you order the test? And they order the test, and just like that vitamin D, it's not low, so they're told they're what?
No.
You're completely normal. So now the patient starts to go, maybe I'm the problem. So who does she go to now? That's my biggest question for you is, where does she go? Yeah, therapist be around you. But she goes from this doctor, no. Who are you seeing? Well, I'll maybe go see your doctor. Same thing? Huh. You? No? Nothing's wrong with me? No. So they start doing what? They start doing what everybody else does. They go on, they Google it, they YouTube it, they try to find their own answers, right? They start going and spending their hard-earned money trying to get themselves better, which I love. And then they end up here. Right? And Dr. Karen's like, your spine is a mess. That's interfering with how your nervous system and your immune system's working. Get on the table. And now she's giving you an opportunity that you can order blood work through her office. And then it gets sent to me, and I'm going to analyze it. Right? I'm going to look at it, do the whole report, get it all done for you. So you see, like on this, again, that vitamin D is critically important. It's critically important to know what the number is. The first test is very important, but what's even more important? The first test now, you take some vitamin D, whatever dosage we say, and then we should do what? Retest it. So typically, we're going to give you a 3-month. Right, Mr. Gross?
Yep.
We're going to give you a 3-month recommendation, and in 3 months, what's going to happen? Retest. So the first test is very important, but what's even more important is the second test. So let's look at that. I want to talk about a couple things. Here comes a 68-year-old male with back pain and burning feet. So he's got back pain. Is he miserable, ornery son of a bitch? Huh? He is just like, usually not fun to be around, right? Suffering, hurting. He's got high blood pressure and prediabetes. So let's just have a quick peek at a couple things for him. When we order the blood panel, now look, 68-year-old male, you know how he comes into this office because his wife dragged him in by the ear. You got to come see Dr. Karen. He's like, all right, I'll just do what you say. And so he finally comes in, starts getting worked on, and Dr. Karen's like, we got to do blood work. So we do the blood work, and we understand, wait a minute, before we go any further, burning feet, what does that mean? His nerves are what? His nerves are dying. His nerves are dying. The burning feet. So you see the commercial, just take Lyrica. Just take all the different, just cover it up. His feet are dying. So what do you think's involved? His what? If his nerves are going to be involved.
Right.
What would you want to look at based on tonight's class? What B vitamins you want to look at? B what? B9 and B12. So let's do that. First thing we look at is his red blood cell count. Think millions of dollars. Men should have $5 million worth of red blood cells. He has how many? 3 point? He's 1.5 million shy.
Wow.
Where are his blood cells? Remind me, what do blood cells carry? Oxygen. So if you're not carrying all that oxygen, how well are you going to recover? Like, are your nerves going to recover with no oxygen? How's the back? Yet Dr. Karen gives him the best adjustment. He goes in the hyperbaric chamber. He gets the other therapies done. He's sitting on the little seat cushion doing his exercises. But if you don't have enough oxygen, it's going to take a long time to get better, isn't it?
Yes.
So right away we're like, oh, this guy, and he doesn't have enough oxygen, so his blood pressure has to go up to try and circulate the blood around faster. Okay, now look, his B12 is lab low, not yellow. It's lab low. What does he need? B what?
12.
B12. And how much? Again, let us be the expert. Let us guide you on that, right? The folate, we want it to be at least 10. At least. And he's at 7.3. He doesn't have any B9. He doesn't have any B12. He doesn't have any oxygen. How's the wilting plant going to get better? That's the question, right? So we have to be able to identify these metabolic subluxations, but more importantly, we have to do what? We have to correct them. Ready? What do you guys think about that? His vitamin D is?
Whoa.
How many of you want a 35.9 vitamin D? Hands up, who wants that? Nobody? That's normal. So, you see how just on a very simple scenario we can identify so many things that are going on with this individual, and then Dr. Karen can say, listen, you don't have enough oxygen, you don't have enough B9, you don't have enough B12, you don't have enough vitamin D. How about we fix those while we're getting you adjusted so we can accelerate your time to healing? Let's get you better, faster. So the first test is important, but what again? The first test is important, but the second test is even more. Now we have a 41-year-old exhausted mom. Every other mother that comes into the practice, at least, right? Exhausted, wiped out, but moms don't get a day off, right? They got to keep on keeping on. So, we'll just look at a couple things here with this individual. Now, anything in red means it's where? In the sick person zone, right? So her white blood cells, those are your immune cells. Hers are lab low. How well do you think mom fights infection? She doesn't have any white blood cells. She's sick and run down all the time. And again, to point this out, look at her red blood cell count. Look at the lab range. It's 3.9 million to 5 million. She's at 3 point. So she's what? Normal. There's nothing wrong with you. Right? There's nothing wrong with you. Are you sure, Doc? Yes. Stop reading all the stuff online. There's nothing wrong with you. Your blood works completely
Normal.
That's why people are frustrated. Right? That's why so many individuals we see, and that's why I teach so many medical doctors. They're frustrated too, because they know that the system that they're in is not working. They know that. They're trying to make a big change. What's most important for this lady? Well, we have to get rid of this. We have to figure out why she has low red blood cells and low white blood cells. And then we're going to retest, right? We're going to intervene. We're going to do some things. We're going to say, how can we make you that much better? Any kids come in this practice? You guys ever come in here and see kids getting adjusted?
Yeah.
Were you shocked the first time you saw that?
Yeah.
As a adult, come in. The 3-year-old got low back pain? Sciatica? How many of you have learned a lot about health and wellness since you've been a patient here at the office? Right, that spinal health matters, but not only spinal health, but I know Dr. Karen and the team does other talks, right? There's always some community event. So you're learning a lot about being in the health and wellness model. So it's no surprise that 8-year-olds will come into the practice. So a young 8-year-old will come into this practice, and Dr. Karen is going to evaluate her spine, look for these subluxations, and get her adjusted. Okay. Walk me through this now, if you would, please. She's 8. She has attention deficit disorder, and she has headaches. Is she a wilting plant?
Yeah.
What's the solution to the problem to start with? Who's going to start taking care of her first? Mom, right? So what's mom going to do? Honey, I'm sorry you have headaches, so why don't we give you some children's Tylenols, maybe aspirins, whatever, something. Get to bed earlier, maybe we should change your diet, not enough, no more McDonald's this week. Something, like mom's going to try for a little while. Teacher's complaining, she's not doing well in school. So at some point mom says, okay, we have to go where? Where does she take her baby? To her pediatrician, correct? Okay, what's the pediatrician do? Pediatrician has how many minutes? Not many, right? A couple minutes, 10 maybe, right? And in that 10 minutes, they can diagnose her with what? And give her what?
Ritalin.
What is Ritalin?
Speed.
It's speed. You know it's a class 2 narcotic? Did you know that? It's a class 2 narcotic. Ready? You know what else is a class 2 narcotic? Cocaine and meth. It's cocaine, meth, Ritalin. They're all Schedule 2 narcotics. So you take an 8-year-old and now she starts getting Ritalin to paint the leaves green, right? And she gets a headache medication, whatever one it's going to be. So that starts. And over a period of time, the headaches aren't getting any better. So now what's the solution to the problem? Mom goes back to the pediatrician. Pediatrician says, I've done all I can. I'm going to send you to who? The pediatric neurologist. So now they go to the pediatric neurologist who has the big guns, right? They're going to do an MRI, and it's probably going to come back fine, normal. Rare that the 8-year-old's going to have a tumor or something driving that. So now the doc says, I'm going to give you the heavy hitters for your headache. Keep taking the Ritalin, but now we're going to give you the heavy hitters, like anti-seizure medication, like Topamax, for example. Right? You start to give all the heavy drugs, and just remind me, like, when's the 8-year-old going to stop that stuff?
Never.
You know, like, when do you stop? Same thing with the antidepressants. Look how bad I am on this stuff. How am I ever going to get off of it? Right? If that's your 8-year-old little girl, and that's not isolated anymore, right? How often do you think the pediatricians typically run blood work on a case like this? They don't. If they do, it's very bottom of the barrel. Right? There's stuff within the system. Again, I'm not blaming the medical provider. I really truly feel that they're doing their best. I don't think they want to spend 10 minutes with you, 5 minutes with you. I think they'd love to do more, but I got to do charts, I got things, I got patients, insurance companies tell me what to do. You think she deserves to have some blood work done?
Yes.
Okay. Should we look at her B9 and her B12? Should we look at her vitamin D and her magnesium and her red blood cell count and her sugar? This is some other testing that we haven't talked to you about yet, but this is homocysteine, this first marker here. Homocysteine, have you heard of it? Anyone?
Yeah.
Homocysteine is the most inflammatory marker that we have. Ready? I want you to see her number. It's lab high at 15, okay? Over 7, when it's over 7, we know it starts to destroy the neurons in your brain. At 15, we know it starts to destroy your arteries to your heart and other cardiovascular tissue. She's at 15.4. Her pediatrician called me, barking at me, where do you get off ordering homocysteine on an 8-year-old? And my response was, where do you get off not ordering? Like, you're completely ignoring this.
before I say anything else, do you think that that amount of inflammation that we know is inflaming her brain, do you think that's why maybe she can't focus and she's got a headache? She's hungover without drinking. You see? And a lot of the women in the room here probably know because it's so prevalent, her TSH is lab high. What does that mean? She has a what problem?
Thyroid problem.
Thyroid problem. Her TSH is lab high, so she has low functioning thyroid. You need your thyroid hormone that gives you energy. It turns on every metabolism in every cell in the body. So when you don't have enough thyroid hormone, you're exhausted all the time. You can't focus, you can't concentrate. You get brain fog. So this 8-year-old has massive amounts of inflammation and a thyroid problem, and to top it off, you see this marker right here? That tells us she has the #1 autoimmune disease in the world. That's what she has. She has, her thyroid problem is an autoimmune disorder. It's called Hashimoto's autoimmune hypothyroidism. It's the most common autoimmune disease on the planet. She has it at age 8. When do you think we should start intervening?
Now,
What do you want her vitamin D to be?
100,
What is it?
100.
100, yeah. Good job, guys. 100. Because she has autoimmunity, right? And autoimmunity means that the immune system needs to function at its best. My mom has Hashimoto's. My dad has Hashimoto's. My 3 sisters have Hashimoto's. My brother has low thyroid function without Hashimoto's, and I don't have it. So I had a huge patient base of Hashimoto's hypothyroid patients. That was a huge part of my practice. And I always say to the patients, like, this is very personal to me. My entire family has exactly what you have. This is not a game. And the medical profession doesn't care on this. And I'm not being harsh to that. I'll tell any endocrinologist on the planet, and they know it's true. Because this doesn't matter. All they're going to do is they're going to paint the leaf green. They're going to give you thyroid medication and ignore the autoimmune disease. Some of you in this room have this. I know you do. Right? So this young 8-year-old, it's not that she just needs Ritalin and Tylenol. She needs someone to look at her and say, oh my God, you're massively inflamed. Let's look at your diet. Let's look at your vitamin D, your B9, your B12. Let's look at your oxygen levels. We've got to get this inflammation down. There's a product called NAC. Okay, NAC plus that you can get here. And it helps to lower that. B9 and B12 helps to lower that. So we need to know the numbers. What's most important for this little girl? Do you guys think that even if her spine was perfectly straight, do you think that she should be getting adjusted at this office? Absolutely. She should be on that table, getting adjusted, getting her nervous system free to allow nerves to go uninterrupted to all the body parts. She should be getting adjusted, and her metabolic subluxation should be getting adjusted, right? We should be doing something to help her at age 8. Because you know what she typically presents? As the 40-year-old fatigued female who's heavier than she wants to be and can't get pregnant. Right? That's who she becomes. It's important for us to do the test. It's important for us to intervene. And I know here at this office, Dr. Karen, you don't just come in and you get your evaluation done. You're going to have a reevaluation at some point, right? Check up, how you doing? Things getting better, worse, pre-post x-rays, what have you. Same thing here. The first test is important, but what? Second test is? More important. Thank you. So many people present as the wilting plant. We're not interested in just cutting off all the leaves. Painting the leaves green, sticking a post up its backside so it stands tall. Right? We want to give it what? Water, the sunshine, right? Nutrients, and love. Do you guys feel loved in this office? Don't you love walking in here? You feel loved, don't you? Is it markedly different than walking in the other office? Take a seat. No one taught, you know what I mean? It's completely different, isn't it? The paradigms are completely different. So we're very interested in looking at you as a wilting plant. How do we help you thrive? Dr. Karen and her team are very interested in identifying and correcting your vertebral subluxations, but also very interested in correcting your metabolic subluxations. So what will happen is you'll have blood work performed. Local, how close is the lab court?
There's one in
Hinsdale?
Ogden Avenue.
Yeah, right around the corner, right?
In the Dooley office.
So you go to Hinsdale, you don't need an appointment, you can just walk in Tuesday morning at 7 o'clock or 8 o'clock in the morning, walk right in, get your blood work drawn, and out you go.
You have to be fasting, right?
You have to be fasting. And what will happen is you'll have the blood test performed. Sam and Susanna will send the lab results to me, and I'm going to generate this report. Some of you have your reports here tonight. Mr. Coase, have you had a report ever like this before in your life with your blood work?
Never.
Never. Detailed, right?
Very.
Very detailed. And then the team's going to schedule you for a webinar. Did you happen to watch the webinar yet?
I am not.
You have not. Okay, so this is a very important story. And actually, my business partner, Dr. Steve Giannopoulos, he does most of the video. Both of us were on it one time, then we edited it. Now he's the only one doing it, which is fine. But you'll watch this, and it'll take you through a story. What's important about blood sugar? What's important about vitamin D? What's important about your thyroid? And so it's a story kind of like we're telling you tonight. And it'll help you relate to your blood work. So you have the blood work done, you have a report performed, you watch a webinar, you're going to take some supplements. Are they supplements that we're just going like, what should I take? It's not that, right? We're going to base your supplements off of what?
Results.
Off your results. And then in 3 months, we're going to do what? Retest. Does that make sense for everyone? All right, we're going to retest. Because we need to know if you're taking enough of it. Sometimes you're taking too much. And sometimes, despite all your efforts, things still aren't where they need to be. And that's okay. That's okay because it makes me say, okay, we need to do a couple extra things here to get this individual from point A to point B. Does that make sense?
Yeah.
Awesome. So again, here at Abundant Health Chiropractic, right? They want you to walk on this journey with you to a more healthy, a more abundant, more vibrant life. So I want to thank everybody for letting me come here tonight. Doc, if you want to come on up and take the crew home here. A very important thing I just wanted to mention is that I'm going to hang out here for a little bit. So I know some of you brought your blood work. And I have my glasses, so that's good. So I'll hang off to the side, and I'll, as best I can, get through all of you and tell you what I think you should be kind of doing, and what the next step should be. Doc, I'll let you take it from there.
That was awesome, wasn't that? I met Dr. Tom about a year ago, and so he's been talking to me about some of this lab stuff. And it took me a little while to really decide to integrate this into our office. And actually, I have a personal story about this. So about 2 months ago, I have one of my really close friends, 39-year-old chiropractor, so passionate about health, Ayurvedic, like she was so deep into the holistic world of health, but I don't think she ever did blood work on herself. And she ended up having a little bit of jaundice, went to the hospital, found out she had liver cirrhosis, and 10 days later died. Stage 4 liver cancer. Didn't drink. And so I look at this as I wish she knew this, which is why I decided that everybody needed to know